Hello and a massive welcome to everyone that's joined us first thing on a Monday morning. Thanks for waking up and coming along. My name's Chris Thomas. I'm head of the Commission on Health and Prosperity at IPPR. And I'll be chairing today's session, which for my money couldn't be on a more important or salient topic really on healthy places, prosperous lives, and how we can make sure that place health and prosperity are aligned in terms of delivering a better future for lots of people in the UK. This webinar comes as a launch event for our recent Commission report, Healthy Places, Prosperous Lives. It does what it says on the tin. And we'll be talking a lot about some of the research and some of the findings that constituted that report and hearing reactions from a really exciting lineup of panelists. And I'll save the actual insights for our speakers shortly, and I'll introduce the panelists shortly too. But it falls to me just to give a little bit of housekeeping and a little bit of background to the Commission. So on the housekeeping side, the only thing really to say is that please put your questions throughout the session as you hear something interesting or something jumps to mind you'd like to ask. Please feel free to put your questions in the Q&A function. The Q&A function rather than the chat, we're liable to miss things that go into the chat, but the Q&A function will be where I'll be looking for questions to pose to our panelists as we go through today's event. We'll run today for about 75 minutes, so you should be back at your desk with lots of research thoughts and lots of views from interesting people by 10:15. We'll have a mix of opening remarks and Q&A as we go through. So there'll be some time to hear some thoughts and there'll be some time to ask questions as well. So we'll keep it moving at a good pace. I think unless anyone waves at me, that's it for housekeeping. So let me introduce the Commission. And for those that are newer to the Commission on Health and Prosperity, we're an initiative that launched around 2 years ago, just under 2 years ago, with a single hypothesis, really, that a fairer country is a healthier one, that in turn a healthier country is a more prosperous one. And indeed, the idea that guides us is that is the concept that the health of the country is actually the greatest untapped route we have to prosperity as a whole in the UK. And we've been doing lots of research, lots of policy analysis to, one, understand if our hunch that health and prosperity are really intricately related holds true, and two, to understand the kind of policy implications and the new way of doing health policy that emerges once that relationship is understood and proven. Over the course of that period, we've released a range of interim reports. As I say, Healthy Places, Prosperous Lives is the third of what will be 4 of them. And we plan to release our final report on health and prosperity later this year. Really excited to be having this conversation, and something that will form and inform a culmination of several years of work in the not too distant future. So let me, without further delay, just introduce some of our speakers today. So we're first hear from our very own Afia Poco-Amanfo, who is a research fellow at IPPR. She was lead author of Healthy Places, Prosperous Lives, and it really was a big undertaking. Afia has been around the country talking to communities, talking to experts, talking to mayors over the last 18 months. Before working at IPPR, Afia had experience in European Parliament. At IPPR, she leads our schoolwork as well as our Healthy Places work. So really excited to hear more about the research from you. And then we'll be joined by 3 speakers who I don't think between them could have more expertise and experience in this very topic. So we'll be joined by Mayor Andy Burnham, who, as you'll all of course know, is Mayor of Greater Manchester, elected in May 2017, re-elected in 2021. Andy's priorities for Greater Manchester include building a London-style integrated transport system, ending rough sleeping, transforming Greater Manchester into one of the greenest city regions in Europe, and making Greater Manchester a great place to grow up, get on, and grow old in. Of course, before being elected Mayor of Greater Manchester, Andy also held ministerial positions in the Home Office, Department for Health, and the Treasury. That combination of health and treasury, of course, very important for any conversation on health and prosperity. We're joined also by Sir Norman Lamb, former Minister of State for Care and Support. So again, as you'll all know, Sir Norman Lamb was the Liberal Democrat MP for North Norfolk from 2001 to 2019. Served as a minister in the Department for Business, Innovation and Skills before being appointed Minister of State for Care and Support. And Norman has worked on issues ranging from social care to getting parity of esteem right between mental health and physical health, to pushing prevention up the ladder and making sure it's prevention as well as cure. In 2019, Norman became an advisor for Kooth, the longest established digital mental health provider in the UK, and received his knighthood, citing particularly his mental health campaigning. And last but very much not least, we're joined by Professor Donald Hall, CBE, who has been described as a public service pioneer, was formerly CEO of Wigan Council, leading the Wigan Deal, has a background in local government and voluntary work, has chaired the think tank New Local, is a professor, honorary professor of politics at the University of Manchester, a non-executive advisor to Cardinal Farrer at CIPFA and Mutual Ventures Limited, and chair of Social Care Enterprise Possibilities, who in other work we have cited as a case study. They're brilliant. So as you can hear, an absolutely huge amount of experience on the panel today, and we're really hoping that it's an interesting conversation when we get there. So that's probably enough talking from me. I will hand over to Via, who will talk us through some of the research, some of the findings, and just get us gently into the conversation this morning. So thank you very much. Over to you, Via.
Thanks, Chris, and hello all, and thank you for joining us this morning to hear about the Commission's new report, Healthy Places, Prosperous Lives. So as Chris mentioned, I'm Afia Pokwamantho. I'm the lead author for the report, and this has been an 18-month-long piece of work. We've undertaken qualitative and quantitative analysis, exploring trends across health and the economy. We've spoken to people across the UK, local leaders, and public health experts as well, to develop a new framework to unlock the potential of places. And in doing this research, what we found is incredibly concerning. People living in the most deprived local authorities in England are nearly 1.5 times more likely to experience economic inactivity, and they're also twice as likely to be in poor health than those in the least deprived authorities. And those deprived areas tend to be in the Northwest and the East Midlands, so places like Liverpool, Manchester and Nottingham. And when we compare this to places in the Southeast, like Hampshire, Oxfordshire and Wokingham, you then see a really stark contrast in economic inactivity and poor health. And whilst our analysis has identified great inequality between those places across the nation, evidence also shows that there's inequality within those places as well. So people within perhaps the same postcode, not living far away from each other, can have significantly different health outcomes despite being, maybe less than a mile away from each other. We also found a 20-year gap in healthy life expectancy between the most and the least deprived places across the nation. So, for example, in Liverpool, healthy life expectancy is just 58 years. In Wokingham, the healthy life expectancy is 70 years. So we know, and one of the essence of this report is, we know that if everywhere in the UK was as healthy as Wokingham, then we'd be the healthiest country in the world and would be much wealthier too. And that isn't just because we would have a really great, thriving health service, but actually people would have the right foundations for a healthy life. But unfortunately, we know that the 7 foundations that you see that we outlined in the report, that those 7 foundations aren't given or accessed equally across the UK. And these foundations are things that, we're all familiar with and we all strive to have. So things like a safe home, clean air, a good job, early years support and childcare, freedom from addiction, and ensuring that we have strong relationships and just overall having a healthy mind and body. But in addition to those foundations, we also know that local leaders themselves haven't been given the resources and they haven't been given the powers either to adequately sort of provide this for their local population. So if these foundations aren't being guaranteed to every single person, then across the nation, our local economies are going to be weak, and the health of our nation just won't recover. So given the scale of this problem, our report has proposed a new policy framework called Health and Prosperity Improvement Zones, also kind of abbreviated to HAPPY zones. And HAPPY zones, the way we've been thinking about them as protected areas in the most deprived parts of the country. It's very much an interventionist approach, to improve healthy life expectancy of people living in these zones. And these zones will have new resources and powers given to sort of local and combined authorities so that they can build sort of strong and stable workforce, also work with local communities in a meaningful way, and just overall kind of tap into that unlocked potential in those places across the nation. So I think I'll conclude there, but yeah, really happy to be here today and have this discussion, and looking to hearing from your questions when we get to them.
Brilliant, fantastic. Thank you so much, Fia. And I can see some questions starting to pop up in the Q&A. Feel free to keep throwing them in there as you hear something you want to ask about or reflect on. I think we have Mayor Andy Burnham with us, who I'll have down to turn to next. If you're there, Andy. Yes, I see you. Could we come to you next?
I am, Chris. Good morning, everybody. Great to join you and to follow Efwa. I want to speak very strongly in support of the policy concept she was ending on, the concept of health and prosperity improvement zones. I suppose you could put it another way, couldn't you? That means a place-based approach to health improvement. I can see Professor Donna Hall nodding there, because Donna very much pioneered the Greater Manchester approach that we still stick to today. The concept of starting with communities, joining the dots within them, and then working bottom up to improve them. That's was the Wigan deal, and it's still what we hold to. And I think I'm in a position, perhaps better than anybody, Chris, to say how the old way of trying to improve the health of the nation hasn't worked. And when and maybe Norman too, when I describe the old way, it is that silo-based, top-down approach from Whitehall. At best, as health secretary, you can stop people's health getting worse. That's what you can do if you have, very well organised health services. But health improvement is a very different thing. And actually, the interventions from the Department of Health over many years, well-intentioned, but those public health interventions just haven't moved the dial. And something very different is needed, and it is that place-based approach, or you could call it, the Marmot city regions approach. It's the same concept, and the country really now needs to move towards it. And the reason why we do is because we just all lived through a period where we saw in real time that the sort of spatial dimension to health inequality. If we cast our minds back to July 2020, when the first areas started to go under local restrictions after the first national lockdown was lifted, those are the areas that have had poor health for, I wouldn't just say decades, centuries is probably more accurate. So you are talking about those Greater Manchester, Lancashire, West Yorkshire mill towns. That's where we have some of the worst housing in this country. People remarked at the time, actually, that the areas that went under those restrictions were effectively the housing pathfinder areas of the Labour government of the early 2000s. These issues are long-standing and entrenched, and they were the places that went back under restrictions. In those places, it's in some ways dangerous to simplify, but here goes. It's a combination. I think the two primary factors that cause poor health are poor housing linked to insecure work. That's the problem. And that, I would say, was the thing that was the two main reasons that were behind why those areas, why the virus had a hold in those areas, and we just couldn't break the grip of it. So if I start with work, the reality is, and this kind of touches not just on the model of the way we've done things, but the ideology, the move towards an outsourced nation where we've just allowed employment standards to be stripped back for people on the lowest incomes has a consequence. In a pandemic, the consequence was millions of our fellow citizens didn't have access to sick pay. So they had to stay in work if they were ill. I would say that's a bad thing at any time. If someone has to stay in work because they are ill, that's a bad thing anytime, but it's downright dangerous in a pandemic. But that was what we saw being played out in front of us, and many requests to the government to give people access to self-isolation support, sick pay, just fell on deaf ears. It's not surprising, therefore, is it, that the virus had a hold. And then, of course, people were returning home to poor quality, overcrowded housing. If we don't act on that, I think we are doing the coming generations a sort of huge disservice. The next pandemic could be much more deadly than COVID-19. If we're in a situation still where people's employment status is so poor that they can't go home if they're ill, then it could have had much more serious consequences. And this is why this concept of a health and prosperity improvement zone, actually, it's not just right for those people and those places where we need to see that improvement. It's right for everybody, isn't it? The pandemic reminds us that this is bad for everybody if we don't have a situation where people can look after their own health. We have evidence. The good news is, after the sort of the negative side of this, that place-based approach does work. So we had population health devolution in Greater Manchester. People will know from the middle part of the last decade. The Lancet did a report on it on 2022, and it found that we had managed pre-pandemic to improve life expectancy faster than expected, particularly in our more deprived areas. How did that happen? I would say it was particularly linked to our work on homelessness, and I think we managed to prevent premature death from rough sleeping, and that probably was the thing that maybe most moved those figures. However, as Donna will recall, we were really getting going on school readiness, closing the gap between Greater Manchester and England. And the Lancet study said it was because of the high degree of alignment between all players on the Greater Manchester pitch, not just public sector partners, but community, voluntary sector, private sector. That's what actually moved the dial, joining the dots, everybody pulling in the same direction. So that actually works. And the question is, are we prepared to give it a proper go through much more widespread and deeper devolution in England? I would love to be able to have the chance to introduce some health and prosperity improvement zones in Greater Manchester. And it's actually in some ways not complicated. What would I do with some of the funding that's suggested? Well, I think first off, you would improve people's homes. Housing is health starts with housing, doesn't it? If you've not got a good home, you're unlikely to have good health. And it's not just the physical condition of the property. If your tenancy is insecure, that can erode your mental health and well-being as well. But we've got millions of people living in that situation. If you look at the private rented sector, in Greater Manchester, it's estimated around 40% of those homes are beneath the decent home standard. What chance have you got of improving people's health if your housing stock is in that position? And of course, I'm speaking to you from the city region where a 2-year-old boy was killed by the damp and mold in his socially rented home. Housing has to come first. The Finnish have a national philosophy of housing first. It's not just a homelessness project, although they do have housing first projects for homelessness, but they have a kind of national philosophy that if people haven't got good housing, they haven't got anything. And I would start in those zones with a major home improvement program that actually could take in the retrofitting of homes as well, so that you kind of leave people with better homes that are cheaper to run. We would like in Greater Manchester to link housing benefit to the condition of people's homes. I don't see as a country why we are funneling billions of pounds into the pockets of not all landlords, but some landlords who do not maintain the homes they are renting out to a basic, decent standard. Why are we doing that? We've negotiated the power through our latest Trailblazer devolution deal to introduce conditionality between housing benefit and housing standards. And we think this is something that really should be done and taken nationwide. But we would certainly start to prove that concept in a health and prosperity improvement zone. Alongside that, we would have a huge drive on work and employment standards. We have a good employment charter in Greater Manchester, and we are proposing to link it to all public procurement. And this would deal with sick pay, as I mentioned before, but more broadly, it would improve people's job security. We are in the process of re-regulating buses in Greater Manchester, and we have linked the Good Employment Charter to that process. And actually, what it will mean is every single operator, by the end of it, will be a member of the Greater Manchester Good Employment Charter. What does that mean? It means every driver will have access to sick pay from day one, and they don't at the moment. And again, you've got to ask yourself this: how are we allowing public-facing roles in transport or retail or hospitality, where the employment standards are so poor that people might be ill in those roles in those communities? I cannot get my head around it. If you're going to do something simple to improve health, give everybody access to sick pay. And I hope Labour's New Deal for Working People will absolutely do this. It's just absolutely unbelievable in this day and age that we don't give people that. But it's more than that, isn't it? It's improving housing as well. Chris, if I've got time, I'm just going to mention one final thing quickly, if I may.
Please do, absolutely.
Because it goes back to, I mentioned Michael Marmot before, and Michael presented his groundbreaking report on health inequalities to me as Health Secretary in 2010. And I always remember a conversation I had with him where I kind of asked him to really boil down, if I had to really sort of focus on what would change things. I mean, obviously, I've mentioned housing and work, and that those two things are absolutely fundamentals. But beyond that, Michael said the biggest way in which a life course may be altered is whether or not kids arrive at school ready to learn. That is a very big driver of whether or not people are likely then to have health throughout their life. But he also said it's also linked to whether people leave formal education as teenagers with a sense of hope and direction for the future. And this is one where I think we need to do much more as a country. The survey we do of our teenagers suggests that 1 in 5 year 10s in Greater Manchester say they don't have hope for the future, which is a hard statistic to see, but that is what they say. And obviously, if you're in that position as a teenager, the chances are that you're going to perhaps engage in things that are damaging to your health, not constructive activities. That's quite high if you're feeling like that at that age. This is where I'm getting to our new mission that's coming if I'm re-elected in May. I will make the reform of technical education in Greater Manchester a first order mission for our city region, because the reality we've got at the moment is the university route has been allowed to dominate education under all governments of all colours, and too many young people get to their middle teenage years and can't see a path for themselves. And some of them then, I think, do end up moving towards, as I said, damaging activities, poor health. We must correct that. And we are talking about, in Greater Manchester, 2 clear equal paths at 14, alongside the English Baccalaureate, creating a Greater Manchester Baccalaureate that will take people to T-levels, apprenticeships, and hopefully a good job, and then a good life and good health. And I could say much more about this, but I won't. But I think this is critically linked to whether people do have hope at their sort of end of their school years, going into their adult life. And at the moment, a third of kids in Greater Manchester take the English Baccalaureate, a third of kids go on to university. So 2/3, I would say, the education system is not working or not designed for 2/3 of our kids. That's the reality. And it's not surprising that some of them then don't feel hopeful. That has to be fixed. And our mission is to create the UK's first integrated technical education system and the Greater Manchester Baccalaureate. And that, for me, as well, is critical if you're to drive health in some of our poorest places. Health comes from hope. And if you don't have hope, you don't have health. And again, would be something where in those health and prosperity improvement zones, we would work hard to ensure that every kid growing up in those places had a path at 14 to something that they wanted to do. And for kids who perhaps on the with special educational needs or on the autistic spectrum, that supported path, or kids at risk of violence, they had a referral to a supported path. That's the way in my view, you try and build a system that gives hope to everybody. So I'll pause there, Chris. I just would say thank you to IPPR, for pioneering the concept of a place-based approach to health improvement. Donna proved it in Wigan. We've shown it in Greater Manchester. This is the thing. This is the only thing, actually. Joining the dots from the bottom up and getting everybody pulling in the same direction. That's the only thing that will improve health. It's time the country got serious about it.
Fantastic. Thank you so much, Andy. And health comes from hope, I think, is a beautiful summary of it. I want to bring Norman and Donna in, but I have one question that I wanted to use Chair's prerogative to ask, which is that, Andy, you've been in the Department of Health, now Department of Health and Social Care. You've been in Treasury and obviously the mayoral role. And I think if there's a message from our research, it is bluntly that you need to empower local leaders to do health improvement, and we're in agreement that you can't do that necessarily from a central office in DHSC. But we know that the politics of the NHS is always towards the NHS and the acute, and that the public tend to understand health as the NHS. And we also know that Treasury struggle to invest in health because of the long-term returns. So it's quite difficult. So my question is, how do we break through those politics and create space for ourselves to really kind of go for local approaches in the kind that we're talking about here today?
With wholesale political reform is the answer. The country is wired for inequality. That's my conclusion, having kind of lived within the Whitehall system, tried to work within it. And then when you leave it and you look back at it, you just realize that, we're wired for inequality, basically. If you look at how Westminster works, basically, as I mentioned, the silos, and that's, if you're going to try and, if you've got an over-centralized political system as we have, with no, until devolution, no meaningful regional layer, we're the only country in the world that's trying to run, an entire country like that. I've said before that only 50 people run the country actually in that system, because the way the whip system works is the Parliament transfers its power to Whitehall basically, and it just rubber stamps what comes out of Whitehall. And I would say only 50 people in that system are truly running the country. That's also dysfunctional in normal times to run a country like that. But it's dangerous again in a pandemic. And the COVID public inquiry is revealing this, isn't it? Decisions from a handful of people were foisted on millions, and we saw the consequences of it. They were so far from the ground, that tier 3 situation that I had with them. And then you look, you add into that dysfunctional system things like the Green Book, which prioritizes the spending of public money in areas where the economy is already strongest. It's why we are wired for inequality. The poorest parts of the country are not prioritized for public investment. It's the opposite, in fact. I had the scales fell from my eyes actually as Chief Secretary to the Treasury. I realized all of a sudden why we had such a big north-south divide. I realized it wasn't an accident. It's national policy. So to me, I personally have come to the view, and the Mayor of Liverpool and I are writing a book about this very topic at the moment. It's out next month. But we argue that you need wholesale reform. You need to rewire Parliament and the country fundamentally, and from it then have maximum devolution out to all people, all places. A Barnett formula for England, so that we start to get some fairness in funding across all of the constituent regions and nations of the UK, proportional representation for the Commons, a Senate for the nations, regions for the Lords. If your Parliament doesn't represent all places equally, how on earth have you got a chance of addressing some of these entrenched inequalities? If you've got more people in the House of Lords who went to Eton than were born in Greater Manchester or the Liverpool City region. You know, how are the needs of our places ever going to get prioritised in a kind of parliament that's still like that? You know, and you're not, basically. So I've come to the view we need absolutely root and branch, wholesale political reform that kind of then goes beyond just empowering places through that, also empowers people. I believe myself that we need what I would call a Grenfell law in this country, and that a Grenfell law is in UK law, all people have a right to a good, safe home. That to me is absolutely, you know, we've got to get away from this idea that, you know, you sell everything off, you deregulate everything, somehow things get miraculously better. They don't. You know, in that situation, you empower vested interests. You do not, you know, empower the public or the public interest. And that's like, you know, that's where we've got to. We're in a position where, if you look across the country, I'll finish on this Chris, because this is a bit of a theme for me at the moment. Communities aren't in control of basics that improve health. They are not in control of their housing. As I said before, you know, it was all sold off, and it's barely regulated. So people can rent out homes and they can't even be at a decent standard. So communities do not control something as basic as housing. Communities don't control something as basic as buses. Well, we're taking control of them now, but for decades, people have not controlled those things. Work has been, you know, employment standards have just been stripped away. No wonder people feel alienated in communities. So it's wholesale political reform is the answer. I bet you didn't expect that on a Monday morning, did you?
A lot to grapple with on a Monday morning, but I should mention Beyond its Health Commission work has a programme on democratic reform and renewal, which if anyone in the audience is interested, I'm sure we can put some links in the chat, or otherwise it's on our website. So Norman, I wanted to come to you next for some remarks, responses, and some thoughts on some of the stuff that you've heard so far.
Yeah, thanks very much indeed. And I'll start by saying I 100% agree with Andy Burnham on his sort of prescription for what needs to change. Wholesale political reform. We are the most centralised country in Europe, apart from, I think, Malta, and they probably have a good reason to be centralised. We don't, and it has awful consequences. I wanted to start by applauding Afia for her brilliant work, together with obviously colleagues at IPPR. But this is really a really significant report, which I endorse completely. I think any new government, I mean, we talk a lot about the productivity problem in this country. Any new government that wants to get to grips with why our productivity in this country has been so weak has to address the issues in this report, and in my view has to implement what is proposed in this report. We are failing to exploit, in the best possible sense of the word, our human capital across our country, and unless we confront the causes of that, we will continue to fail as a country. The UK, in terms of our health, is, I think, worse than most European countries. If we think particularly about mental health, the numbers of people who are out of work because of mental ill health now are at record levels. This is a phenomenon which is a deeply problematic issue for our country, and it needs to be confronted. And the regional variation, the inequality across our country, and the fact that the poorest communities suffer both the poorest health and the poorest economic outcomes is a scar on our country, which we should not be willing to tolerate. It's both wrong and it's stupid because it fails to make the best use of our human capital. I wanted to just raise a novel concept which we call brain capital. I spoke at a conference in New York back in September last year under the auspices of the United Nations. And this idea that brain capital, the collective power of our brains, which involves both brain health, but also the education we give to people. Andy talked about the importance of reforming technical education, which is a vitally important element of that. But brain health and brain capacity should be seen as a key national asset if we are to succeed in confronting the big challenges we face as a society. And at the moment, palpably, we are failing to achieve that objective. And that's why, again, this report is so important. When we come then to the question of what are the enablers for making this new approach, which the report outlines, possible. Well, first, as Andy said, it has to involve significant devolution of power from the centre to localities. And that must include, in my view, tax raising power. Now, you have to have a fair distribution of money from the centre. The centre needs to be willing to invest in the poorest communities. But we also need to empower communities across the country to make their own decisions about raising tax, to invest in their communities. But it needs, on top of that, guidance and support from the centre. So a collaboration between centre and locality to realise the ambitions of this report. And then, and I think the report also addresses this, there needs to be a mechanism to hold localities to account to deliver on the ambitions that we set out in the report. I wanted to mention one particular innovation that we're pursuing. I chair the South London and Maudsley, which is a very large mental health trust in South East London. And what I see of the mental health system is a system that is very passive. We don't intervene early to prevent people falling into ill health, to address all those social determinants that we've been talking about today. We wait for demand to hit us, and then too often we institutionalize people, we act with coercion, and that has a disproportionate impact on people from Black communities. And that is, again, an unacceptable aspect of the mental health system. Poorer Black people suffer more through the mental health system than anyone else. And that race dimension is wholly unacceptable. So at the South London Maudsley, we're working on developing and implementing a new model of care, which is more community-based, which confronts those issues earlier on in collaboration with third sector and with local authorities, and which sees employment as a key goal for people. When we ask people who use our services what they are most frustrated about, employment is the most important thing to people. And yet within the mental health system, it's a completely marginal issue. That needs to change. That attitude of mind needs to change within the NHS. The final thing to say, Chris, is about the role of employers. Now, back in 2017, I chaired a mental health commission in the West Midlands for the West Midlands Combined Authority. And we came up with the idea of a well-being premium. Now, this would be a fiscal incentive, perhaps a discount on national insurance, to incentivize employers to take action, which we know, evidence-based action, which will improve the well-being of their workforce. Training of line managers is one key example of how you can improve the well-being of people in the workplace. And if they do that, then it's a win-win for everybody. It makes a significant difference to the life of people in the workplace, but productivity will improve and economic success will be the result. So let's incentivize employers to do the right thing by their employees. So that's it from me, Chris. Strongly endorse this report, and any new government coming in later this year needs to take this seriously and implement it if we are to confront the failure of this country economically and in terms of well-being.
Thank you very much, Norman. And it's brilliant to hear through this the critical mass around the arguments and where change has to come from. There are questions brimming in the Q&A, so those will come in a minute. But before we get there, and I've taken some down to ask, Donna, would love to hear your thoughts, reflections, and any reactions you have to what you've heard today.
That's brilliant. Thanks, Chris. And yeah, well done, Afia. Absolutely brilliant report. I think it really is obvious that you've been out and spoken to real communities and been to real places. It's not just a kind of ivory tower think tank. It's really practical and useful. And I really do hope that any incoming government, as Norman said, really grasps it. I feel unworthy, really, after two of my heroes speaking. And when I saw the agenda of Andy and Norman, I was like, oh my God, I'm definitely not worthy. But absolutely brilliant report. Well done. And it's been great to be part of the commission, although I don't feel I've done anything. I think you've done it all. And I certainly think that the idea of having health and economic development together in an area as a joined up and connected policy is so important. Because currently we've got in England integrated care systems, 42 of them, but the link to economic development and to the work of the combined authority, which is mainly economic, transport and housing linked, is quite tenuous. Maybe they get together once a year and talk about things, but they've not got shared initiatives, shared programs in the main. And I do some work with the ICSs, and ICSs are very much around the management, I think, of the acute system, reducing costs rather than looking at where to invest in prevention, looking at all the evidence shows that if we invest in primary and community care, for every pound that we invest, we get £16 back. That was a recent report by Carnal Farah that showed that. And yet what we tend to do is focus on the acute system, which is right at the very end when things have gone usually really wrong. And I think, really being able to shift that resource into the prevention space, into community and primary care, into some of the social things that we funded in Wigan. So we funded 500 amazing new projects that weren't dreamt up by us as commissioners, but they came from the community. They were ideas which were driven by a desire to improve the mental health of young people in a community, or a desire to address obesity and lack of physical activity or lack of social connection. And it was that investment that managed to add the 7 years of improved healthy life expectancy in the most deprived, in the poorest parts of Wigan, the poorest wards. It wasn't the way that we organised ourselves as public servants. It was that investment in the kind of social safety net and the improving links between people working together in a place. So integrated neighbourhood teams were a really important part of it. Something that Andy introduced in Greater Manchester was this concept of names, not numbers. So, we tend to talk about percentages and numbers and introduce schemes that just layer on top of the dysfunctional system. But what Andy forced us to do, which was brilliant, was to really get to know the people and to form a relational model in a place. So it's not just about continually processing people through the sausage machine of, eligibility criteria and telling them, go away. I'm sorry, we had a classic case in Wigan when we were trying, because I was given the role of trying to run the clinical commissioning group as well as the council. That was fascinating. And what we had with eating disorder services was a BMI, body mass index, as a threshold, as the eligibility criteria. So if you were really struggling with your mental health, but your BMI was too high, we would say, go away. I'm sorry, we can't help you. Your BMI is too high. Go away, get worse, and then come back when you meet our eligibility criteria. And then we will prescribe you a menu of things that we think you like, that we think will actually improve your life. No conversation, no relationship developed. And, what are we as public servants? Are we gatekeepers of eligibility criteria? Or are we innovators and transformers of the way that we work with communities and with citizens? And that was the whole idea of the deal. We froze council tax. We said we would do that to get people through austerity during the worst possible times. And that increased people's income by £500 per household per year, which is quite a bit. So, that whole idea of we're in it together, we're working together in a place, can't be done through national politicians. It just cannot be done. I totally agree with Norman on mental health. I think it's so under-resourced, and the preventative side of it is just not resourced at all effectively. One of the great things, again, that Andy did, that we did together through the Reform Board, which is great. Imagine a combined authority having a public service reform board. That's how it should be, but not a lot of them do. So, you know, that's amazing work by Andy and his team. Was we introduced this thing called Working Well, which was brilliant. It was all about how do we get long-term unemployed people with sometimes complex issues around mental health, drug and alcohol issues very often, generational unemployment. How do we actually get them into employment with support? And again, we use the names, not numbers concept. People got to know the person, and the attachment to this support wasn't through the job centre writing nasty letters to people saying, you've got to go on this programme. It was through GPs, it was through primary care mainly. And we found that the attachment through primary care was much more effective because it was a trusted place that people went to. And in terms of getting people, you mentioned possibilities at the beginning, and we work to support. We've just won the contract, so thanks for that, Andy, to provide support for people with learning disabilities in Greater Manchester into employment. So, you know, this is a really badly needed approach. I would throw a little bit of a challenge in that we shouldn't also just be waiting for the government to seize this initiative. Why can't we do this now? Why can't we do this next week? You know, what's holding us back? What's stopping us? And I know some of the funding stops us, but I think some of that courageous public service leadership, we used to call it in Wigan, a rebel alliance of people who can see what needs to change. Andy's talked about wholesale political reform. I do think that's needed, but I do think it's also needed at the local level amongst public servants, amongst NHS trusts, primary care, social care, and mental health working together around the place, the family, the neighbourhood. Cheers.
Amazing. Thank you so much, Donna. Really, really interesting. Lots of questions bubbling to my mind, but I'm going to come to the Q&A first and foremost. I'll ask a couple of questions in a round, and panelists, if you'd like to pick between them or ones that you find interesting or have something to say on, then feel free to answer and not all of them if you'd like. But we have tons of questions, so I will try to get through as many as possible. We have a theme from the early questions around the difference in need between rural and urban communities, and whether there's a difference that we need an approach depending on how rural, how urban. So really interested in that. We've got a question from Seb, which is, how important is the move to integrated care systems? Does it really help? You've touched a bit on that, Donna, or is it slightly a distraction? A question from Chris Ham on what local leaders need from the centre, and I'd add to that what the optimal relationship between the centre and local is. We've seen subsidiarity trialled with ICSs. We don't always hear reports back that works brilliantly or perfectly or is truly upheld in all places. So are there alternatives? Do we have it right? I'll go to those three first, and then I've got another wave to come to after. And Andy, maybe if I come to you first, and we'll go around the whole group.
Yeah, thanks, Chris, and brilliant to listen to Donna and Norman. And it's kind of great, isn't it, that there's just a growing consensus about this. You know, it's easy to have a sort of council of despair, but to be honest, devolution in England has been a big sort of achievement, really, I think, over the last decade. It is now established. And to answer Chris's question, some of what we want, we are beginning to get. So Greater Manchester and the West Midlands are moving to a single settlement with Whitehall at the next spending review. Not quite on the Wales and Scotland model, but not far off, with some considerable flexibility actually in it, more than I thought, where we would be able to switch capital to revenue, for instance, which, again, as a former chief secretary, I didn't expect us to get, but we have. So that actually is real progress, I would say. And when you have a single settlement with Whitehall, you can do everything Donna was just saying. You can start to reform local public services, because you can say to everybody, well, look, we're not trapped by the bureaucracy of the silos anymore. You know, we can actually do it. Are we bold enough to do it now? And I think that then takes in that relationship with the ICS, you know, kind of, are we ready now to really kind of change how we work? So we're at that sort of moment of truth, really, I think. and the Greater Manchester system is ready to go. But Norman is right too. I think you've got to kind of see this as a sort of journey towards more fiscal independence, and ability to raise more for ourselves. So I think we've just got to keep the pace on this journey. Donna mentioned working well. I think the area that is kind of most ripe for kind of further reform is the Department for Work and Pensions. And I do think it could play a very big role in health and prosperity improvement zones, for instance. You need almost to just come at things from a completely different approach. That names not numbers approach that Donna described that we try and implement here. If anything, DWP is the opposite, isn't it? It's built around a numbers, not names approach, a tick box approach, very top down. We found in the latest negotiation with the government that DWP had become, who were very supportive actually always, but had become quite a sort of a sort of area of resistance to devolution. And I think the reason for it became structural. It wasn't that some of the people didn't believe in it. It's just that their whole model is to let these massive contracts across whole regions that are based on driving down the unit cost of the sort of back to work support, with very big entities. And we were calling for sort of a deal for Greater Manchester, but they couldn't afford a Greater Manchester-sized hole in their big, massive, impersonal, anonymous contract that they wanted to do. And that brought a sort of a disagreement. But what I would say to the Department for Work and Pensions is, if you localize that spend on supporting people back to work and personalize the support then that comes out of it, funnel that money through micro organizations, local organizations, we could get so much more for that money. And then if you start to think about reforming local housing allowance so we could link to housing standards, I think, Chris, to answer Chris Ham, to answer your question, thinking about logical steps and things that are doable, the DWP actually is the thing that you could funnel their money through health and prosperity improvement zones, and almost, not the benefit rates, and that should be set by them nationally. I'm talking about the support funding. That almost should entirely go under local control, in my view, because the benefits of, you would have a more wealth retention approach there, wouldn't you, if you were working through, local organizations. So there is more, and there's plenty I could say on that theme. I'll leave the rural urban to other. Looking at Donna's background, Donna looks like she's more an expert on rural place-based working now than I saw the horse go past you a few times now, Donna. Did that happen in Wigan? Although maybe it did once or twice. I don't know. But let's consider this a journey. And actually, I'm the first to criticise the government in terms of how they've treated the North and treated us at times. However, we have to acknowledge that English devolution is a significant achievement in the last decade. And we need now at the general election, all political parties to say, not just if you have a mayor or not, I think all parts of England need a combined authority. I think you need to shore up the local government base, because that's becoming a risk to English devolution. The scandalous underfunding of local government by Whitehall. And you then need to have a sort of single settlement in time for everywhere, where everywhere gets more flexibility over spending. I think that is actually a realistic plan if you follow the direction the country is going in, and I hope all parties will support it at the general election. And I'll probably have to drop off now, Chris, but thanks for letting me join everybody. I've really, really enjoyed being part of it.
No, thank you so much for joining, Andy. Terrific to have you. Afia, I'll bring you back in here. Anything you wanted to reflect on those questions?
Yeah, definitely. I think on the sort of the role of central government, well, I think firstly, sort of removing the competitive funding that we sort of see, in the words of Tracy Brabin, sort of ridiculous beauty contests. But I also think we need to see kind of real willingness from central government to fully understand that they cannot simply sort of shift the dial on the crisis of health inequalities alone. And I think this is happening to a degree, as Andy just mentioned, and we should celebrate that. But I think they also need to sort of further recognise that local leaders are frankly like the answer to getting to the core of this issue. And that is because of the nature of this problem and the way it manifests is that inequalities, they take place in sort of clusters. So they aren't uniformly spread across the country, but they pop up in different places, often aligned with deprivation. So I think that shift kind of does mean sort of new powers, but it also means kind of the adequate resources as well to use those powers. And then also for current deals that are in place, it also means having conversations that can kind of open up sort of new powers, perhaps that aren't just related to the local health service, but to those 7 foundations that we've outlined in the report. So that could be things on powers to kind of regulate childcare support providers to ensure that every child has a kind of good standard of early years. And then also things like ethical commissioning as well, so that, you know, kind of businesses that kind of take up new sort of business in places are doing that in the interests of the health of that local population. And then just quickly on the difference in kind of rural and urban areas, I think there are challenges that of course do vary across kind of urban and rural areas. This report did take a urban focus, but I think ultimately health inequalities vary across the country generally, and how we've gone about thinking about this work is just not being too prescriptive, but offering a framework that can be used according to the local issues. So I do recognise there are challenges like kind of transport, and people living in rural areas spending a lot more money travelling to and from work, opting for car usage. But I also think this is a problem in urban areas too. So this is a framework that would really need to be implemented with that kind of local understanding to challenge those problems more specifically.
Fantastic, thanks so much. Donna, the pass was played to you by Andy somewhat in the rural-urban split question, but any question you like, what were your reflections?
Yeah, on the rural-urban split, I think the beauty of a happy health and prosperity improvement zone is it's geared to the local circumstances. So although it might look nice up here, there's a real huge amount of poverty in this part of Scotland.
Yeah.
There's a lot of social isolation and loneliness. There's a lot of homelessness. You know, people buy up houses for holiday homes and there's no young people can't get on the property. You know, there's a whole series of issues. So, but the happy could make it really specific to address those issues. Just can I try to answer the one on the ICSs? I think, you know, good start, but it's almost 2 years that they've been set up now. And I think, you know, we need to decide what are they for? What is the purpose? Huge amount of effort on looking at making savings, 33% savings in the first year, you know, and then a real focus on heavy on governance, who sits on which board, creating new teams, you know, huge amount of money spent on creating new teams at the centre. And we've got to be careful we don't replicate the dysfunctional Westminster system in an ICS by having this huge top-heavy infrastructure, but in a local area, there's no investment. You know, it's all just centralising the power. And I think they could be more courageous around investment in prevention. That's my experience of working with some of them. Come on, let's try to shift some of the resources from acute, responsive, reactive into prevention. I don't see that happening, I'll be honest. Cheers.
I'm on mute. Sorry. Thank you, Donna. Totally agree. Norman, what do you think?
Right, very quickly running through. First of all, rural urban. I mean, this is the heart of devolution, because if you devolve power, it's devolved to the area which knows its area. And I represented a rural area for 18 years in Parliament. And the health needs are very, very different to inner city Manchester. And at the moment, you get a one-size-fits-all approach, which is just applied across the country from Whitehall. If power is devolved, then every area can shape their response to the needs of their area. And so you immediately get an approach which is more sensitive to the difference between urban and rural. And I saw in my constituency real hidden deprivation that people just don't realise is there in a rural area. It looks like a rural idyll, but hidden away, people living in massive poverty with absolutely no access to services, and often children brought up in very narrow circumstances with little access to other things that are taken for granted by others in more urban areas. So that's the great value of a devolved approach. Secondly, on ICSs, as a chair of a trust, I work as part of the South East London ICS. I agree with Donna. I think the jury is out. At the moment, it feels quite bureaucratic. We sit in endless meetings. There's lots of talking shops. But if I ask the question, has the money shifted at all out of hospital and towards prevention? The answer is no. The amount we're talking about in investing in prevention is minute. And when the system is under such financial stress, it's very difficult for a local system to shift resources. So we need to address both the financial stress within the NHS, but I think we also need new powers to make them more effective in taking advantage of the opportunities, and we need greater equality for local government within that ICS system, in my view. And then finally, in answer to Chris Ham's point, what do we need from the centre? Well, I would say enable, invest and support. The centre can set the principles, pass the legislation that enables the introduction of these zones, but you leave it to the local area to design the zone to meet the needs of that locality. That must be the right thing, but you provide financial support for that process. You provide tax raising powers so that the local area has some power to change their circumstances, and you provide guidance and support for the centre to facilitate the work that's being done within the locality. I would agree with Andy Burnham that devolution has been a success, but it is partial. There are so many parts of the country that have not benefited. My own part of the country, Norfolk and Suffolk, we haven't had any devolution. So it needs to be a comprehensive deal that gives the right to every locality to take control of their destiny. And I agree finally on DWP. You think about the amount of money from DWP that is actually being spent in the poorest communities, but is it being spent in the most effective way to transform those communities? Almost certainly not.
Really, really interesting. Thank you, Norman. I think we've got time for another round, and I'm going to apologise to those whose questions we don't get to. We've got about 50 in the chat, but I will theme them around where we've had lots of similar questions so far. So lots of questions touching on the theme of culture and how important culture is. Donna, I know that's something you've done lots of work on. I wanted to come to a question that was in there around some of the specifics. So what can we do on things like unhealthy and ultra-processed food, and whether there are any specific levers there? And then about 7 or 8 questions have touched on that question of what we can do with the private sector or employers, a mix of those. So Jack Eddy, David Walker, Mike Indian, Paul Al, amongst those that have asked that question. And I suppose that's in the context of local government struggling, and we've seen some bankruptcies and financial struggles. So do we need to do more to drive investment from other sources? And we might bring the voluntary sector into the mix in that conversation as well. Why don't we go around the other way? And Norman, I'll come to you first, and we'll loop round counterclockwise.
I thought you were going to give me a little bit more time after I just answer the question, but that's absolutely fine. You mentioned employers. Just to develop a little bit further the idea that I mentioned in my opening comments about wellbeing premium. Simon Stevens raised this when he designed what he called the 5-year forward view for the NHS. He highlighted the fact that in our system, the employers are pretty passive. You tend to get great employers, some great employers who really understand that if you look after the well-being of your workforce, it pays dividends in greater productivity and everyone benefits. But there are too many employers who don't get that link and who continue to behave in a way that undermines the well-being of their workforce and seeks to gain a fast buck, but at the expense of people's health and well-being. and actually it's not sustainable. So yeah, I'm a great fan of the concept of B corporations, where Patagonia is a good example as a company which recognizes that as a company, it doesn't just have responsibility to its shareholders, but it has responsibilities that are wider than that, social, environmental, and towards their own employees. And I think if we can find ways of incentivizing employers to behave in a way that supports their workforce and indeed is environmentally responsible as well, then I think we could pay real dividends. So look, I'll allow others to come in after making those remarks.
Brilliant, thank you, Norman. Donna, we'll come to you next.
Yeah, I think just on the whole issue of culture, I really do feel we need a massive cultural shake-up of the way we work together. You know, I think there's lots of opportunities to have meetings together, but the real work happens with integrated teams of people working on the front line in neighbourhoods. And I don't think we allow that to happen. I don't think we give people the permission to innovate that they need to have in those local areas. And I think, you know, with a health and prosperity improvement zone, maybe we could. I remember the old days of, because I'm old, health action zones. We set one up in my local area, and we really worked together. We took our lanyards off. We got to know each other. We got to know the people, the names, not the numbers, who we were helping, all helping in different ways, but we weren't working together as a team around the person. So it requires a different type of leadership. I wrote an article about it. I'll circulate it around. A different type of leadership, which is not about command and control and micromanagement, but it's much more around setting a kind of values-based framework and then allowing people to just get on and do it. And I don't think in the NHS and in local government that we do that routinely, but it's shown, it certainly was shown in Wigan, it's been shown elsewhere, that different way of working reaps huge benefits. Some amazing work going on in Northumbria at the moment, Changing Futures Northumbria. I don't know if you've heard of their liberated method, but it's absolutely amazing. So it's a liberating people from eligibility criteria, rules-based thresholds, and allowing people to support people, to build a relationship with them and help them in a meaningful way. It's much more cost effective. It's bespoke by default, by design. And people say that's too expensive, but it's actually less expensive because we're constantly assessing people. 80% of our time in Wigan was spent on assessment and referral. 80% of public service resource going into that. What the hell is that all about? So let's shift that. That's where the cultural dial really needs to be shifted. And in terms of local government, yeah, I completely agree. They're not around the table as equal partners to the NHS. One chief exec of a very large county council described to me her feeling of being a guest at an NHS, a house guest at an NHS party, being part of the ICS. And, you know, that's not how it should be. Having said that, I do think local government really needs to shake up the way that it works. You know, I don't know if you've seen with all the bankruptcies that have been announced that many councils are saying there are only 2 or 3 children being brought into care away from being bankrupt. The whole way that we run social care in local government needs to change. It needs to have better funding, but it also needs to be much more human, much more around prevention and support, rather than around institutionalizing people, which is the way that Norman's described it. The massive privatization of children's social care, where children are going from placement to placement. And I'm not sure if you saw the fantastic Children's Social Care Review led by Josh McAllister. Nothing's been done about it. It's just been parked. But he showed a way, which is very neighbourhood based, of reducing the costs of children's social care by working differently with, again, a team around the child, a team around the family. So a huge amount of change needed.
Thanks so much, Donna. Really interesting. And last but very much not least, Sophia, over to you.
Thanks. So I guess I'll come back on the food point, which is like obviously really key when it comes to health, especially given the current sort of cost of living crisis. I guess I can point to a couple of case studies that we highlighted in the report that have really strong evidence of, firstly, a cost benefit for public services, but also tackle that crisis of food and show that local leaders can and do use their levers when it comes to a food crisis. So firstly, universal free school meals seen in London, and that's a policy that's, you know, truly universal for every child. So it means no child who might not quite qualify due to the kind of threshold that's kind of outlined there, you know, won't have to worry about where they get their lunch. And there's really strong evidence as well that, you know, not having to worry about your lunch and having free school meals can support things like school engagement and cognitive processing for children and their school career as well. And then we also highlight other efforts to tackle sort of childhood obesity, so things undertaken in Leeds, but also internationally in places like Amsterdam. We've seen a real effort from local leaders to prioritise prevention, so focusing on things like the amount of hours of sports that children might be doing every week, the types of food that they might have access to. Yeah, so those are just some examples of how local leaders have essentially identified a problem that's happening and that's really acute in their area, and essentially got on with tackling it. And then I think just on the business point, I think ethical commissioning and social corporate responsibility is something that we've outlined in the report, and we should really push forward in where relevant in the implementation of a happy zone. But also the good work charters that we've seen across England are, you know, a great example of something employers can sign up to. But also finally, just thinking about the people that we spoke to and what they wanted to see in their local areas is actually them having the ability to kind of create their own kind of business. So people want to kind of have a kind of familiarity on who's running their local businesses, having small businesses, and essentially not necessarily having a kind of monopoly of big corporations kind of taking over their places, but actually having opportunities for them to start their own businesses as well. And I think, you know, that will align with kind of well-being and the relationships part that is also really key for health as well.
Fantastic. Really interesting remarks. And I think you know, we've got 2 minutes left, so it's probably worth me just giving some reflections on what I think we've heard today. But I think we've heard that there is a challenge in that we know that there are some very profound inequalities across the country, some places where health outcomes aren't as good as they should be, and that tends to cluster with other forms of economic and social inequalities that we care about, whether that's economic inactivity is keeping the Treasury awake at night at the moment, or whether that's poverty and deprivation. Those things tend to emerge in the same places, but that there are solutions. There's good work already going on out there, as Afia, your report points out, lots of case studies that we can find. And if we have the means and a national government that enable the means to spread those case studies, to really personalize the approach place to place, then we could deliver massive transformational outcomes. And indeed, as was said at the start of this session, if we were only as healthy across the whole country as in Wokingham or Maidenhead, then we'd be the healthiest country in the world. A journey that we've seen other countries take. A country like Japan that was in the 60s, one of the least healthy countries in the G7, now the healthiest by quite a long way, but not only the healthiest, one of the most equal. And that starts to tell you where its gains came from and how its strategy developed in terms of delivering that progress. In terms of what you can expect from IPPR in the coming months, lots of interest today in employers, in businesses. Our next and final interim paper will focus very much on that topic, exploring how we can put health at the heart of our economy and transition towards an economy that prioritises good health. We'll have our final report of the Commission on Health and Prosperity out later this year. If you'd like to submit some ideas, throw some case studies, or just have a conversation around that process, we'd love to hear from you. So please do get in touch. This is a commission that's all about collaboration. So we'd love to speak more. And that won't be the end either. We'll be continuing to work on all things health and prosperity in the aftermath too. So do keep in touch. Do keep following IPPR. So I'll finish with just a huge thank you to our panelists. I think that was a genuinely super interesting conversation to start a Monday on, and So that's a thank you to Sir Norman Lamb, to Professor Donna Hall, to Afia Poku-Amanfo, and to Mayor Andy Burnham. But most of all, thank you to everyone that came in such good numbers. It was amazing to have so many people here, such a kind of lively chat and Q&A. So thank you for spending the first 75 minutes of your Monday this week with us. And we hope to see you again very, very soon. So thank you and have a good rest of your week.